Kingsley, a registered nurse with a keen understanding of computers and healthcare, has joined the implementation team for a new electronic health record. His team has addressed ethical and legal issues with this new technology, developing policies and procedures for staff and physicians to use in this new technology will guide safe and secure healthcare information in the facility. Healthcare informatics is a design of communication, information, and documentation in an electronic health record, or EHR. It's necessary to work through legal and ethical issues before the purchase of this technology ever occurs. A successful go-live or launch of this technology depends on the team and the type of software chosen. Let's now take a look at some of the legal issues found in healthcare informatics. 1. Protecting health information. It's required by law to handle all patient health information with confidentiality, meaning no one should have access to the patient's health record unless they're actively caring for that patient, and they should never share information with someone outside the patient care team. The cost of breaking confidentiality is high. Disciplinary action within the organization, lawsuits, fines, and professional regulatory body disciplinary actions, from state boards of nursing for instance, may occur. Security extends from the confidentiality of the patient's record to the actual cybersecurity of the hospital's informatics systems. Keeping hackers out is a huge concern for both patients and organizations. Social networking is another area of concern. Kingsley's team has produced a strong social media policy to keep patient information secure. 2. Health information technology vendors. In 2016, over 4,000 healthcare facilities were using software or health information technology, or HIT. This is an ongoing relationship between vendors, healthcare organizations. Strict guidelines must be followed by law for the HIT to be accepted by Medicare and receive payment for services rendered. The EHR must be certified as capable of handling the information, and communication needs provide security for patients' information confidentiality and be functional for staff and providers, including standardized care plans. Kingsley's team will meet with several companies to choose the right health record. Here are some vendors' considerations that are usually taken into account. A good fit for the staff and providers for a long-term contract. Flexibility of the vendor to meet the organization's needs, since things can change quickly. Partnership with the same quality and safety goals as the organization. Complete training and support package meeting staff and physicians' needs throughout implementation and transition. Ability to provide needed data collection tools, training, and design flexibility. Security in place for EHR software and interface or communication with other programs. Clear and concise curriculum for trainees to learn new technology. 3. Healthcare informatics and patient safety. A core responsibility of healthcare technology is to build the workflow with the patient's safety in mind. At every decision point, there is error vulnerability for staff and patients. The design of the EHR must provide information and knowledge links in the record for staff, such as information about medication ordered. The vendor, organization, and provider must have common goals to keep the potential for errors low by decision support, a built-in alert and guidance system to catch errors before they happen. Kingsley has brought patient identification and accurate medication barcoding to staff in advance of the new technology. Every patient must have an armband with barcodes, and every medication must also have barcodes to scan prior to giving medications. Safety alerts can pop up to prevent errors at this time. The EHR needs to be easily understood, clearly visible, accessible, and organized for documentation and finding needed information about the patient quickly. As healthcare informatics continues to grow, increasing ethical concerns need to be addressed. First, protecting patient confidentiality will require a strong policy and procedure securing patients' health records. Electronic surveillance must be in place to monitor who has access and who accessed the records. Here are some aspects of ethical issues in healthcare informatics. 1. Biobanking. Biobanking is defined as information and/or biological data stored for research, studies, and trials, also called secondary data use. The data is collected for use outside direct care of the patient. Biobanking is connected with ethical and legal issues, such as storing patient information, tracking information, and handling human tissue samples. Questions can arise as patients do not have autonomy in getting this information. Informed consent is important prior to gathering this data, and results of the research impacting the patient may need to be shared with others. Keeping confidentiality is crucial to biobanking. 2. Surveillance and public health. Healthcare informatics provides an exchange of information from health records to public health departments who collect data that is reportable by law as a public health concern. The Centers for Disease Control and public health departments gather data to monitor for spread or outbreaks of disease and potential injuries. Common items reported are sexually transmitted disease, influenza-positive results, and information collected during natural disasters. 3. Patients' right to know. Patients are increasing the use of technology in their homes. Telehealth is now in many remote locations, and the need for training patients and securing their data will need the same level of confidentiality. Telehealth allows providers and patients to address medical concerns and discuss options right in their homes. Healthcare informatics allows the patient record to contain information, communication, and documentation of the patient's care, usually in an electronic health record, called EHR. Health Information Technology, or HIT, is the software for staff and providers to access while caring for the patient. Meaningful use is using certified EHR to improve quality and safety, coordinate care between providers, standardize care across the nation, and deliver a secure and confidential EHR. Safer care is a requirement of the HIT, with decision support being one way to assist staff and reduce errors. Decision support gives knowledge and information for the safest decision in the plan of care and at the vulnerable risk areas, such as giving medication or blood transfusions. Biobanking is related to storing patient data and tissue for research, also known as secondary data. Many ethical and legal issues can arise here, including informed consent.